Hello everyone, this is Satya Samireddy. In this video, I'm going to talk about bioavailability of oral drugs. Why bioavailability is for oral drugs? Why can't it be for injectable drugs, such as injections and salines and others? Before going into details of that, let us see the meaning of bioavailability. It is the amount of administered drug readily available for systemic circulation. What is systemic circulation? Systemic circulation is the state when the drug is readily available for circulation to various parts of our body. Particularly, it happens when it is present in the blood. This is the reason why for injectable drugs, the bioavailability is 100%, whereas for oral drugs, it's not, because it has to go through 3 different stages where there are various losses exist. You can see here in this, when we take the oral drug, any drug like capsule or tablet, it has to pass through 3 stages where 3 different kinds of losses are there. After that, it is ready for the systemic circulation, and the amount of drug present in the state is called the bioavailability. Let us see the comparison of this figure with these steps. Once if we take any kind of oral medicine, so it has to pass through stomach and the gastrointestinal tract. So during this stage, the drug has to get dissolved, right? So, but it is not necessary that 100% of drug has to get dissolved. It depends on the drug, how much amount of drug has to be dissolved. So it is the characteristic property of the drug in according to our pH condition in the body. So for suppose 100 milligram of drug, what we have taken, among it, 50 milligram is still undissolved, and remaining amount is 85 milligram is available for next stage. Next stage is the stage where the drug is being absorbed by the gut wall. So the GI tract, the gut wall absorbs the drug, but the gut wall may not have to absorb all the drug, the available drug. So here, for suppose here 10 milligram drug is absorbed by the gut wall, and the remaining is the 75 is available for next stage. Next stage is loss due to first lever passes. What is it? It is due to after absorption by the gut wall, it has to pass through portal vein, where the portal vein allows this drug passes from portal vein to liver. So during this passes, there is a loss. This is called as a first lever passes. So here 20 milligram is the loss, for suppose it is the example here I'm giving here. So during the first lever passes through portal vein, and the remaining amount of drug is 55 milligram, or 55% of drug still remains. This is called the bioavailability of this particular drug after these losses. And this is the state when it is readily available for systemic circulation. See the comparison between IV fluids and oral drugs. Why for IV fluids bioavailability is 100%? Why? Because bioavailability means it is readily available for systemic circulation. So it means that it is present in the blood or serum, right? So when we inject the injections or whatever, the salines, it is readily available in the blood. So the bioavailability must be 100%, right? But for oral drugs, it's not the case. It varies from 1 to 100%, as I explained. So there are different kinds of losses. If you see the drug concentration in the serum, comparing with the the intravenous fluids and the oral drugs comparison. If you see, immediately the concentration drug is available within immediately within half an hour, almost peak level reaches, and almost within 2 hours it is the concentration is 100% right in serum. Whereas if for all drugs it takes longer time, 6 to 8 hours. That is the difference. This is the reason why intravenous fluids such as injections and saline cure faster than oral drugs, right? As we know. And let us see the examples of different pharmaceutical drugs and their functions. We can see different functions here. I have given here the table and different therapeutic use and protein binding and metabolism where it happens. Metabolism, most the drugs mostly for liver. The third stage, what I explained. And since the topic here is the bioavailability, so if you look at the bioavailability of all four drugs, it varies, depends on the drug, right? So it means that this is the state, the amount of drug present after the third stage, first level passes after that. If you look at uh, the second table of pharmaceutical drugs here, the bioavailability is different for different uh, type of drugs, you can see. But here, for albendazole, it is very low because the metabolism doesn't occur in the liver. Because albendazole is used for killing the parasitic worms present in the stomach, right? So the metabolism is different here. So it's not through that process here what I explained in the above the three stages, and because it will not go to the liver, so it's not applicable here. So hope you learned something from this video, and thank you for watching. That's it.